So, good evening, my dear students. So, today the topic is just to tell you how to study physiology in a right way for MBBS student, first year student mainly. So, this is the approach that how you want to approach the subject. Actually, in the first year, we know we have anatomy, physiology, biochemistry. So, a lot of time they say, sir, physiology we used to study, but we cannot remember. It is very hard to study Genome, Guyton. What is the exact approach that not only we can pass in the MBBS exam, we should get good marks, and also we should build the concept. So this is a small session only to tell you to give you the glimpse of the subject and the pattern how to study. So number one, we must know what is physiology, why physiology matters. Our seniors used to say physiology, pharmacology, pathology, and medicine. They are like four pillars of the medical science. So physiology is like one important pillar. It is the language of medicine. We say it is the why of medicine. It is a why. Whenever we say why in medical science, answer will be in physiology. For example, in medical science, you will study in hypocalcemia, there will be carpopedial spasm. You must know. In physiology, you will study why there will be carpopedial spasm during hypocalcemia. Okay. So like that everywhere, everything, what is tetany, what is Taussie's sign. So whatever we are going to study in the 19 subjects, the why, the concept of that subject will be answered in physiology. It is the language of medicine, number one. Okay. So to understand anything deeply, we need the concept. And this subject is purely based on the concept. You cannot mug up and you cannot clear the exam. Nowadays in the MBBS, they are giving all the clinical scenario question. Only if you understand the question, only then you can answer those questions. Gone are the days when we used to write the essays on the cardiac cycle. Yes, good evening, Dr. Heman, Dr. Amul, good evening. So, purpose is that it is not about the hard work, it is about the smart work. And for that, before beginning the subject, you must know about this. So, number one thing is that it is based on the concepts. Okay. And don't worry, it is a very easy to build concept if you have proper guidance. Number two, it connects anatomy with the clinical practice. For example, we know there are three subjects: physiology, anatomy, and biochemistry. So it is connecting anatomy. For example, in the anatomy, you are reading the connections of basal ganglion. Okay, so you know this is the basal ganglion. These are the part of the basal ganglion. In physiology, you will understand functions of basal ganglion. What are the functions? What they are doing? Okay, or in cerebellum, you are reading cerebellum. So in anatomy, you will understand these are the pathways of cerebellum. In physiology, we are going to discuss the function of cerebellum, and if there is a lesion of cerebellum, what will be the clinical features. Okay, so this is connecting your anatomy with the clinical practice. Okay, for example, you know why heart rate increases during exercise. It is also solving the queries. As a doctor, you must know whenever you are doing exercise, heart rate increases. Why? How? Or number two, why does pulse changes after standing up? Suppose you are lying down, you are lying like that, and suddenly you stand up. All blood will go to the it will pull to the legs. So when blood is pulling to the legs, why heart rate is going to increase? And then we can understand this concept with the knowledge of baroreceptor reflex. So only if you know baroreceptor reflex, only then you can know while standing why heart rate will increase. What is the Mary's law? Or I'm telling you the basic thing. For example, nowadays we are wearing this blue cut rays in the evening because we are watching the laptop, and you are wearing the blue cut goggles or blue cut rays. Why? Because in the evening, if you are watching the laptop, okay, the blue light will come to your ganglion. Ganglions are having a pigment, and that pigment is called as melanopsin. That melanopsin will give you signal it is day. So although this is the evening 5 p.m., but your brain will get signal it is day. So we will form more of the serotonin, but in the evening we need more of the melatonin. So the circadian rhythm. Okay, so if you want to achieve good health, circadian rhythm nowadays is the most important thing. because patients will ask you, sir, when to study, when to sleep. All those questions will be solved only by the knowledge of physiology. But we should not wear the blue cut goggles in the day. Why? Because in the day you want to give signal this day. If you're wearing blue cut goggles in the day, what will happen? Your retina will not get the signal, so it cannot produce the serotonin. It can give depression also. So these all day to day life queries, okay, which are dealing with the health. Out of the 19 subject, physiology is the only subject that will tell you about the health, the healthy part. Okay. Now we know the three pillars of physiology. Physiology can be judicially divided into three categories. Number one can be cellular physiology. So although you are in the intermediate, you are reading about the cell and all those things, you already know about the cell membrane. But in the medical physiology, we will tell that what are the component of the cell membrane, what will happen if there is a mutation of certain part or the muscle. Like in the muscle, there is a protein called as dystrophin. If there is a mutation of the dystrophin, it causes Duchenne muscular dystrophy. So in the cellular physiology, we will tell about the action potential, about the resting membrane potential. See, in physiology, what is life? What is life? It is called as resting membrane potential. We are living because we are having RMP. So it is not that you have to mug up the RMP and you have to write in the exam and you will pass. No. Now they will not ask the question on RMP like that. They will give you question in the exam that a patient is admitted in the ICU. He is having hyperkalemia. Why heart can stop in hyperkalemia? Why we should give calcium gluconate? So that whole concept can be understood only if you know topic of RMP and action potential. And if you go to the app of DocTutorials, we discuss every clinical aspect of physiology along with the topic. So in the cellular physiology, we will discuss RMP, action potential. In the systemic physiology, we can discuss like cardiophysiology, neurophysiology. Now, cardiophysiology can be again divided into mechanical aspect like cardiac cycle, then the electrical aspect like ECG, electrical activity of the heart, and the third can be like regulation of the BP. So like that, there should be a clear cut demarcation. What are the topics which we need to understand and the main point. It is not that you have to study whole Ganong, whole Gaitan. No, if you know what to study in that book, then it will be easier to pick the book and study those topics. Okay, then integrative physiology, systems are working together. Like when I am teaching about the counter current physiology, then in the pharma, you can understand about the diuretics. Do you know diuretics? Diuretics are the drug which can be given to reduce the edema. So diuretics can be understood only if you know in detail about the counter current mechanism. Only about the counter current mechanism. So it is not like that you mug up the counter current, write in the exam and pass. No. Now they will ask in the examination, a patient is admitted to the ICU, he is having pulmonary edema, and we have given diuretic furosemide. Now tell me, what is the physiology on which furosemide is acting? Okay, so until unless you know what is counter current mechanism, which pump is required for counter current, we know NKCC pump is required, and the diuretic drug will block this channel so that water will come in the urine. So it is all based on the integrated physiology. When you go to the third year in the pediatrics, you will read if there is a mutation of NKCC, it causes Bartter syndrome. I know you don't know these terms. I'm just telling you examples so you can understand what is the purpose of reading counter current. What is the purpose of reading RMP? When I was in the first year, I was very skeptical. Why I'm reading action potential? I want to become doctor. Why reading RMP, action potential, Donen's effect? Okay, why I'm reading sodium potassium pump? Because you know in the pharmacology you will be taught that digitalis block sodium potassium pump. So until unless you know the basic physiology, you cannot understand about the pathology, about the pharmacology, about the medicine. And believe me, physiology is very interesting. It is very interesting. I'm telling you. Once you start developing, I mean, interest in physiology, you'll be very happy. Like nowadays, we are having why? What is intermittent fasting? If you want to lose weight, what is autophagy? Nobel Prize was given for autophagy in physiology and medicine. So these are the day-to-day questions which patients are asking from you, or even you must be aware. If you want to become doctor, you must be healthy. What should be the lifestyle? What is the circadian pattern? What which exercise is better? Yoga is better, or aerobic is better, or gym exercises are better. So the whole physiology of the day-to-day life will be discussed in this. Okay, like example, exercise involves CVS. Nowadays, you must be seeing in the news that someone is doing treadmill and he suffered from heart attack. तो treadmill करना है कि नहीं करना? Should we do it or not? Yes, but the susceptible individual, those who can have angina, if they are running, automatically what will happen? Diastolic period will reduce and blood will not reach to the heart and they will suffer from heart attack. So the basics of all those theory will be discussed here. So whenever you are reading physiology, try to understand why I'm studying cardiac cycle. Because if cardiac cycle will not happen properly, okay, ejection fraction will reduce. It is called as heart failure. So this is very important why we are studying this. Okay, and day to day, almost every week or after every 15 days, I will try to come on YouTube to solve all your doubts also. Don't worry about that. And you can also be in touch with the WhatsApp group or whatever. So that, because see, I am a doctor, my father was a doctor, so he has guided me. So although I know what to study, so like that, guidance is very important. Either your father, your brother is a doctor, or some colleague is there, he's having some brother, he can guide you. So this guidance is very essential. Otherwise, there are 19 subjects. It is not important to study everything, but it is important to study something very nicely. Okay, so how to study each system? I always say, for example, you want to study a forest. Okay, you cannot start the leaf. First see the forest. Then see there are there are 400 plants. Okay, one plant is like green. I mean, plant A variety, plant B variety, plant C, plant D. Then in the plants there are branches and then leaves. So always have a broad view, like cardiac side. Like for example, you are studying neurophysiology. In the neurophysiology, we have sensory system, we have motor system, we have higher centers. So like that, you must have a makeup. Okay, sensory physiology. It starts from someone is touching your skin and you are feeling on your brain. It starts from your skin, then goes to spinal cord, then to the thalamus, and then to the cortex. So there is a system like that, na? Then you will study receptor in the skin, then pathway in the spinal cord, then thalamus, and then the cortex. So first a broad view, and then the basic view, and then the receptor view. So always try to build a broad view first of all. This is the forest. So like that, neurosystem, sensory physiology, motor physiology, higher center, basal ganglion, memory and learning. They are the five major chapter. In memory and learning, memory are of two types: short-term memory, long-term memory. So first have a broad view, and then try to enter in that chapter. And second, very important is that always draw flow charts and diagram. Because if you are reading the book, okay, a lot of things are given which need to be cut short. And when you are reading your notes, okay, it will take less time. So always try to summarize important points in the form of flowcharts and diagram, the brain maps, so that you can revise before your examination. Okay, and always add clinical correlation. For example, in the respiratory physiology, you are studying PFT, pulmonary function test. So why we are doing PFT? So that you can differentiate COPD from RLD. COPD was what is COPD? Chronic obstructive pulmonary disease. So like that, always and always try to understand why I am studying this. What is the clinical correlation of this topic? You are studying, suppose, GIT, okay, SCL secretion. So what is the clinical correlation? It can cause ulcer. What are the drugs that are acting on the parietal cell? Okay, so like that. So always make concise notes, color code key points. So note making in the medical science, what I want to say to every student is that without notes you cannot revise. So whatever you are studying, you are seeing the video. Suppose you are open the doctoral app. I've discussed everything in that 3D form. Now notes are also available. You can just take help of those notes also, or you can from those notes you can also draw some flow chart. For example, I have finished my MBBS and MD. Right now I have one notes for every subject, for surgery, for medicine, for anatomy, because with the help of notes you can revise everything. Okay, so try to understand the topic, clinical correlation, and try to make the notes. Okay, then next thing, time management. See, daily, if you are giving 2 hours, it is okay. 1 hour for theory and 1 hour for MCQ or practical. To concretize the theory, you need always to go to the MCQ. Without MCQ practice, you cannot understand the concept. And even in MBBS nowadays, they're asking MCQ. You can see 20 MCQ in every paper. Okay, and weekly you can say day 1 and 2 for theory, and then day 3 and 4 for flow charts. For example, you are studying Monday, Tuesday, you are studying Ganon. Okay, then Wednesday, Thursday, Friday, like that, you can just revise your flow charts. Okay, Saturday and Sunday, you can study the clinical cases which are based on that concept. So always divide your days like that in your medical college. Okay, after coming from college, you can divide your days like Monday, Tuesdays for making notes, studying from book. Wednesday, Thursday, and Friday is for revision, because revision is very important. At least 3 to 4 revisions are mandatory. And then Saturday and Sunday can be for clinical cases. Or Sunday you can just take a break. You can do whatever you want. You can enjoy your life. But Saturday you can opt for those books which are having clinical cases or MCQ. Okay, like that you can make time management. Then tools, lot of confusion regarding the books. Always they are asking me, sir, which book is very good? Guyton, Ganong, Costanzo. So these are excellent books. See, to understand, if you want to understand physiology, understanding answer is Guyton. But nowadays, time constant is there. We have less time. So better to go to the online platform like DocTutorials. There we have three-dimensional videos. Okay, you can make notes from those. If you have enough patience to make notes from Guyton, that is good. But if you don't have time, then you can see the video and you can make notes from that. Or even YouTube channels, you can see right now we are discussing from YouTube only. So the book, the best book for the reference is Genong. Genong is the reference book, because whenever there is doubt, we always consider Genong. But you cannot understand anything from Genong. For understanding, you need guidance. If you don't have videos, video app and all, and you want to understand of your own, then Gaitan is essential. Because Ganong is only reference. Ganong is like notes of important points. For us, Ganong is good. But for if you want to read the Indian author book, then I suggest always GK Pal. GK Pal is a book which is based on Ganong. So language is comparatively easier. So GK Pal is the most authentic book which I have found in the Indian scenario. If you want Indian author in the easy language. But Ganon is a book which everyone should have, because you are studying not only to pass your MBBS. After MBBS, you have to go for NEET PG exam, or NACT. You want to do MD, then DM. So for that, physiology is everywhere. Even if you're studying the surgery, you must know the basics of that surgery, and that will be in the Ganon. So Ganon, every student must have. And if you have video app and all, that will be sufficient. If you don't have, then go for Guyton. Guyton is a book which can help you in understanding the physiology. Castanjo is additional book. If you want more than two books, then Castanjo. Otherwise, Ganong number one. Everyone should have Ganong. There is no compromise. But I'm telling again and again, you cannot understand from Ganong. Ganong is a clinical physiology book. Okay, every few years it is updated. All the Nobel Prize winners and everything is there, and it is the best book. It is the best book. Okay, so you must have. And on the Doc Tutorials app, already videos, lectures are there. Okay, and in the Doc Tutorials app, we have summary videos also. That if you don't have much time, then you can revise whole cardio in just, 1 hour or 2 hours, like that. So there are main videos, topic wise videos, and summary videos before examination. Okay. And also there are flashcard, like for example BP regulation in the form of beautiful flashcard, self test. And the tip is that you should practice flowchart. It is called as Feynman technique. Feynman was a scientist. He was a Nobel laureate. He always say, if you want to study something, always teach that topic. I am teaching from my MBBS days. When I was doing MBBS, I was teaching for NEET UG. When I started doing MD, I started teaching for NEET PG. So from my day one, I am teaching, because by teaching, I start learning. So whenever you start teaching, for example, you are studying today cardiac cycle, and you cannot remember just by teaching your room partner. Don't think that he will also know. He will get better marks than you know. If you are teaching, then you will not forget. Sometimes कहते हैं कि स्टूडेंट्स नहीं मिलना, किसको पढ़ा दें. Then use A4 paper and pretend that someone is sitting beside you and you are teaching to him. You can practice teaching in an empty room, although you are alone. But in the front of mirror, you can teach someone, or just like that, as you can behave as if you are teaching. Because doctor is not only a doctor, he have to be a teacher. Because after MBBS, you will do MD. In the MD, you have to take class for MBBS. Then you become assistant professor, then professor. So everywhere you have to teach. So teaching skills are very important. And the second thing is that when you are teaching, you will not forget. This is called as Feynman technique, and I always use this technique, and it is the best technique. Always try to teach the topic, discuss the topic. You cannot be alone sitting and revising. Okay, you should, for example, in the 7 day, 5 day you can study, 2 days you can discuss. Discussion is very mandatory. So in the first year only, try to have like-minded people along with you so that you can discuss with them. They are going to be very helpful. When I was doing my MBBS, I was having all the friends, two, three friends, which from, for example, I am reading pharma. Okay, so half pharma I will teach him, half pharma he will teach me. So like that, we used to discuss, and this will save the time, and also it will be interactive, interesting. Okay, even now when I meet my friend, they say, "मैंने तुमको वो पढ़ाया था." Okay, like that. So this is very very interesting thing. Now physiology for NEET PG in clinics. So although you are doing your MBBS, but along with the MBBS, you are also preparing for NEET PG, because just after internship you have to appear for your PG, NEET PG examination, INSCT examination. So for that, see, it is not that MBBS course is not sufficient for PG. If you are giving full attention to the concepts, then with the help of your MBBS, you can get good marks in your NEET PG examination. Okay, so you must know, okay, what is difference in the preload versus afterload, like what is the Frankenstein law. So don't try to mug up, try to analyze. And for that, MCQs are most important. If you go to the doctoral app, we have MC question bank, wonderful question bank, faculty curated. Okay, and they are the best MCQ because they are based on the concept, they are not mugging purpose. So when you are doing MCQ, okay, like there is the increased A wave, it is MS or TS, like that. So we'll think, okay, this is TS, not MS. So we'll try to learn by doing a lot of MCQ. Number two, learn early clinical integration. Try to ask from yourself. Okay. For example, if you are measuring BP, so what is blood pressure? It is a lateral pressure exerted by column of blood on the wall of artery. Now it should come to your mind that I am standing, my blood is coming to the legs. Why I don't have synco? What is the mechanism? Baroreceptor. And then you should study, okay, in the baroreceptor, there are carotid sinus, there are aortic sinus. So try to analyze everything, and you start enjoying like anything, as if you are watching some series. It is so interesting. I'm telling you. Okay. And ask yourself which system fail in the patient presentation. Okay, cardiac failure, heart. I mean, so many things are there. I'm not naming because you are new to the medical science, so I will not confuse you. I'm just telling, as time will come, you will understand what is heart failure, what is, I mean, this is this what is it called as heart block, type 1 heart block, second degree heart block, third degree heart block. So when you are reading along with the clinical entity, then you will get a feel of being a doctor. Okay. And concept based learning build diagnostic reasoning. Marks are important, but don't try to get only marks by mugging something. Of course it will take more time to understand, Go to your teacher, discuss the topic with the teachers or your colleague or your seniors. And nowadays, internet is there. It is a boon for us. Okay. Motivation and mindset. See, motivation, and the second thing is discipline. Discipline is more important than motivation, because every day you cannot be motivated enough. Every day is not Sunday. Sometimes you must be feeling good, sometimes you might be having low mood, किसी वजह से मूड अच्छा नहीं है. सो मोटिवेशन रोज नहीं ढूंढो. अगर आप सोचोगे यू आर डे यू आर मोटिवेटेड इन द बिगिनिंग ऑफ योर एमबीबीएस करियर, वी आर ऑल मोटिवेटेड, बट एज टाइम passes ना, automatically lot of things come in the life and we are not that motivated. So discipline is very important. Howsoever is your mind, every day you have to solve MCQ, every day you have to read at least 2 pages of your Ganon, you have to make notes. It is like a disciplined life, because out of discipline, motivation will come. For example, if you are studying every day 2 hours for 20 days continuously, automatically you will be motivated. Okay, so try to make small goals. No need to go for go that I will top and like that. When you study, automatically you will get good marks and you will top. But every day goal can be like 2 day study per day, or you have to finish cardio in 1 week. Like that, you should make some goal, and that should be practical, approachable. Goal should be pragmatic, not dogmatic. It should be practical. Goal should be there, so that will bring confidence, because confidence is a pseudo word. Clarity of mind will give you the confidence. So when you have clarity of the subject, automatically you will be confident enough. Make learning enjoyable through questions and curiosity. So summary: understand the topic. It will take time. It will take time. Have patience in understanding the topic. Patience is very important. For doctor, diligence is very important. You must have a habit of studying for long hours. Patience is what is required. You have to be away from the social media. Okay, there should be a time that from 6 p.m. to 7 or like that for 30 minutes I can see social media. Otherwise, you should be away from the media. And number one is understand the topic. Okay, today I am reading hypothalamus. It will take 1 day, 2 day, 3 day. Second, revision. And for revision, what is important? Notes are important. Then application. How? Clinically. What will happen if lesion of anterior nucleus will happen? Okay, like that. Application to the clinical. What is Papez circuit? What is limbic cortex? Then test. How? By doing MCQ or past papers, then repeat. Okay, and mechanism is more important than memorization. You must know mechanism. For example, carpopedal spasm will happen in hypocalcemia. If you memorize, you will forget. But if you understand, there are voltage gated channels, calcium are guarding. If less calcium will be there, more sodium will go, more action potential, more contraction, and hand become like that. So once you understand that concept, you will not forget. It will bring you long-term memory. Okay, revise regularly and connect to the clinical relevance. Build your foundation, as physiology is the soul of medicine. We know that. Okay, so this is from my side. I will not take much of your time. It was a orientation session, how to approach the subject. And when you will study physiology, for any doubt, you are most welcome. You can ask anything on WhatsApp for any doubt. And if you have any question, you can ask in the chat box. Yes, good evening. Good evening, everyone. Hello. If you have any doubt, anything, any question in your mind, you can ask me. Okay, so no question. So this is it from my side. All the very best. Thank you.